All attendees are in listen-only mode.
Good morning. My name is Tim Kreiner, and thank you for joining today's webinar on digital transformation for healthcare payers. On behalf of Newgen, I'd like to thank the FAHP for this opportunity to speak to the membership. We're a new member, and we're looking forward to lots of interaction with you in the future. A little bit of housekeeping before we get started. If anyone has any questions at any time throughout this presentation, please feel free to send those through the chat window, and the moderator will read those at the end of the session, and then we'll address those issues. So there are two topics that everyone that we talk to in the healthcare industry, and we're talking to virtually everyone in the industry, are interested in. And those topics are digital transformation, which is also called DX, and it's very misunderstood, and customer or member experience. These are two of the hottest technology trends in the whole IT industry, and they're particularly prevalent in healthcare today. So during today's presentation, I'm going to discuss the ecosystem of the healthcare industry along with some of the challenges being faced by organizations with respect to digital transformation. We'll look at these challenges from the perspectives of several different users and see how they currently do their work and how they could improve their work experience, as well as efficiency through the use of digital technology. Next, I'll mention a couple of the digital imperatives and three concepts for you to think about as you explore the evaluation or implementation of digital technology for your organization. Then I'll provide you with some of the current thinking of industry leaders on how they can leverage this technology and considerations that need to be on your radar screen. Before we begin, I'd like to introduce Newgen Technology. We were established in 1992 overseas and quickly became a prominent supplier of digital technology. We've got about 1,500 implementations and about 540 active customers right now. These are customers who have made actual transactions in the last 2 years. Today, we solve complex business problems in over 66 countries and employ about 2,800 employees, about one half of those in the engineering and support functions. And our solutions can be found in 17 different industries. In North America, our primary market is healthcare. We have some very impressive clients, several of whom are listening to this call today, and we welcome a chance to speak with each and every one of you about how we may be able to help you on your digital transformation journey. Our headquarters in the United States is in Washington, D.C., just outside of Washington, D.C., and our customer support center that employs approximately 50 specialists is located in Tampa. Before we get started here, I'd like to pose a question that was recently asked of several thousand people in the healthcare industry by one of the leading industry analysts. And the question is, what kind of quality of member care do you think you're delivering to your customers? It may surprise you to hear that 79% of all health plans that were interviewed, and this includes some of you in the room, believe that they provide excellent customer service. It's a pretty good number. When the analysts interviewed health plan members and asked them about the customer service, only 7% replied that they were receiving good customer service. 93% felt like they were getting less than good or poor customer service. Why and how can something like this happen? And if it's happening to you in your company, do you know which one of those two groups you're in? It's time to evaluate that and try to plug that gap. Now, what do digital transformation and member care have in common? To answer that, you need to understand that digital transformation involves first the application of digital technology to manual processes, and all of our companies are driven by manual processes. And second, real changes in the performance of these processes as a direct result of the digital technology. But digital technology and improved outputs do not equal improved member care. Improved member care is a conscious decision on behalf of organizations that require all parts of the organization to work in harmony with adaptive technology to help them achieve predetermined results. So let's start at the beginning with the universal truth. When change is the only constant in the age of digital, the ability to adapt to changes and respond efficiently is essential. Think about that for just a moment. The healthcare industry today is in one of the most radical states of change it's ever been in, with competing political entities and organizations imposing changes at ever-increasing paces. The industry itself is changing as a result of regulations, penalties, strict oversight. In fact, in the state of California in 2018, there were over $10 million in fines and penalties levied against health plans for silly reasons, where a simple digital platform could have prevented that for a fraction of that cost. Member expectations are also changing. Members, more often than not, are in plans as a direct result of the companies they work for and the programs that they're offered. As businesses are under more and more financial pressure, additional pressures are subjected to the users or employees as reflected in the deductibles and out-of-pocket expenses. And this creates downstream pressure for the health plans. So what does it mean for the health plans? Quite simply, adapt to change or be left behind. So when an organization is able to construct a well-executed digital strategy, it requires and it allows them to re-examine the end-to-end business processes and then to reimagine them in ways that they could never do manually. By applying the benefits of digital technology to the processes, they can design the outcomes in such a manner as to increase the overall experience for all members. And because a well-effected digital strategy will utilize BPM technology, that's business process management technology, there will be seamless automation and integration of multiple systems, applications, and people so that the provider experience is truly seamless. Users will no longer have to work across multiple existing systems, legacy systems, and technologies to perform their job. Last, one of the biggest benefits of the digital technology is that it is near instantaneously available among many different applications. Member and transactional information can be instantly available to anyone in the organization, and real-time reporting allows executives to view organizational efficiency instantaneously, anywhere, anytime, on any type of a device. And you can consider the following examples because every one of you will have these in your organizations. Digitizing your appeals and grievance process will help you provide quicker resolutions, which would lead to superior member experience. This could help you achieve improved star ratings and prevent legal and financial penalties. Just a moment ago, I mentioned the $10 million fine in California. Almost all of those could have been avoided with better access to supporting documents for complaints. Similarly, to provide uninterrupted care delivery to members, it's become necessary to digitize provider contracts and to have a provider contracting management system in place. This helps you reduce the contract cycle times, increase transparency, and increase better compliance. Mobile Medicare enrollment would help you do away with paper-based transactions and capture member information on the go. You'd be able to efficiently track every step of the process from enrollment to reconciliation to servicing. Operational costs associated with printing, scanning, faxing, mailing paper-based documents would reduce significantly, as would the turnaround times. And last, automating and managing member communications would help you personalize high volume, high bulk communications, one-to-one member communications, and on-demand or ad hoc communications for different departments all across the organization, all throughout the life cycle of the member. It would bring consistency in communication while reducing overlapping, redundancy in processes. Some of the challenges in today's health plans can include the following. On the far left, it's not at all uncommon for a health plan to have anywhere from 5 to 20 different legacy applications and systems that employees have to use to do their jobs. In an environment where a healthcare or a health plan is growing through acquisition, and one company acquires another company with a different set of technologies, that problem just multiplied, and integration and growth factors become critical. Next, just as every person is unique, so are all health plan members and providers. Each have their own interests, concerns, demographics, and one size of solution doesn't fit everyone. You have to have solutions that are configurable. Next, the entire healthcare industry grew up on paper and over the last 10 years has been migrating to digital. However, many communications with members continue in paper format today, and therefore simplified management of all corporate documents, electronic and otherwise, becomes even more critical. Last, in an effort to impact outcomes, decisions must be standardized and therefore rules-based. But exceptions will always occur, and they need to be managed in accordance with some form of structured or unstructured methodologies. So let's look at how a few people might experience this in a real-world scenario. Here, meet Ben. Ben's a relationship manager for a medium-sized health plan, and his primary focus is on members and businesses. And to do his job effectively, he should be on the road face-to-face every day with providers, working with their prospects, with their profiles, their needs, and their interests. And instead, he spends a lot of time entering data into multiple and different systems, collecting documents, working off checklists while work is piling up on his desk. Does this sound familiar to any of you? We see it in every single health plan. Annie is a risk officer who ensures that the regulatory mandates and compliance are on top of mind for the organization. She also needs to make sure that the plans are being compensated correctly. She should understand where there are points of risk and ensure the compliance goals are met. This requires an intimate knowledge of all regulated processes and where and how they're meeting, exceeding, or falling short of SLAs. She needs to be able to monitor multiple dynamic data points in real time to do her job effectively. Digital technologies can help both Annie and Ben. In technologies such as document management, mobile technology, workflow, multi-channel capture and input allow Ben to get more work done easily from one device, even if he's mobile or not in the office. In the days when Ben used to have to go to a terminal to look up one piece of information, a mainframe for something else, a PC for something else, and then spend hours on the phone tracking down information, are completely gone in a digital world. That information is readily available. And the same technology that helped Ben will allow Annie to access any data or documents anytime she needs it from one simple user interface. Better still, that information can be real-time and represent real-time status of the performance factors that affect regulatory compliance. When Annie's asked to generate reports either for the CMS, constituents, or her management, those reports can be generated on the fly within minutes and without the need to involve IT. So hopefully now you got an idea of some of the benefits and some of the use cases for digital. We have dozens and dozens of different use cases and be happy to go through with those with you later on. But what type of factors should you be considering? Years ago, we used to look at streamlining business processes with a view of shortening the cycle time. Today, the number one imperative has shifted from increasing throughput and speed to creating a much better user experience and outcomes for our members, especially since every year they become more and more prone to demanding instant gratification. And that concept of instant gratification means that you have to move faster than your competition. It's unfortunate that today's generation doesn't have the patience that we had while growing up, but the reality is the world is changing. Today they have choices and alternatives who are using technology, and they can find a level of service that suits their requirements. And if they know they have a choice, they're not afraid of exercising that. The last concept is a business, creating a business that's infinite. Digital businesses are infinite in the sense that people can work day or night from home or from the office, even from the beach, from a mobile device or from a desktop device. and all interact with people in a structured and unstructured manner that were never before possible. Truly innovative organizations are exploring and embracing digital technologies to deliver this experience to their employees and members. What should you look for while searching for the right solution? First, you need to determine your high-level objectives for digital transformation, and these may vary from plan to plan. They may or they may not include member care experience. Some organizations go about DX, digital transformation, in small incremental steps. Some make giant leaps with a big bang implementation. Both approaches can yield benefits when they're managed correctly, and both can fail miserably if they're not. Second, to be successful, you need to gain management's buy-in, and the best laid digital transformation plans can and will fail if management is only partially committed to the endeavor. Management commitment needs to flow downward throughout the organization until all departments are thoroughly engaged. If not, it doesn't assimilate by the whole company. We're getting some static in background. Can everybody please go on mute?
Muted.
Thank you. According to one Forrester analyst, it's estimated that the majority of failed digital transformation projects fail because the internal legacy systems can't talk to each other. Any process improvement exercise would be limited if its points of integration are limited or restricted to one silo alone. And the limitation will be directly related to the processes or transactions. Processes and transactions may span multiple systems. They're limited if they're only stuck to one system. So transformation requires seamless integration between multiple silos, applications, and people. Next, you need to find a vendor who has the experience you need to help you achieve your goals. Both you and the vendor should be willing to learn from each other to identify the best path forward for a results-oriented exercise. You and your vendor need to openly, honestly interrogate all aspects of your customer and member experience. You need to look for real experiences and trace back to broken processes in any and all systems and applications that they touch. These are oftentimes a source of dissatisfied users. Then you mitigate the risk when your transformation and experience goals involve multiple different types of data, document systems, and processes. Just being able to connect stuff together doesn't mean that it provides valuable or functional integration. And once you do select the right solution, there are some industry best practices on how to build your own successful implementation. First, I suggest consider an agile approach versus a traditional waterfall development method. This is more relevant to the folks in the IT, but this approach engages your users from the initial commencement of the project, and it accelerates the development through a series of what we call development sprints. The timelines are shorter, and the final product is often much better aligned with the expectations. I'm working today with one plan who's got a timeline of 7 months from start to go live for a project using the agile development. That same project would take 12 to 18 months minimum using traditional methods. This is possible through the use of the agile methodology and solution accelerators. And if you haven't heard the term solution accelerators, the use of accelerators allows you to benefit from best practices from other similar customers in your industry, other health plans. These accelerators are pre-built applications that your peers help develop, and we've built into solutions. Now, most critical business processes span different software applications, computer systems, office locations, and they require extensive orchestration to deliver results. Work with your vendor to map a complete business problem or process where each step of the process can be involved and improved. And that's how you're going to achieve both performance and end-to-end experience goals. Now, for the past 20 years, CIOs and CEOs have endorsed the goal of reducing overall number of systems that the organizations acquire, manage, and support. And the cloud can help with some of that, but not all of it. Multiple systems are always going to be required. So try to identify a solution that utilizes a platform approach that can manage your first initiative and still scale to accommodate additional projects yielding long-term returns on investment over time. But don't confuse the concept of a unified platform with an integrated one. A unified platform not only connects to other systems, it becomes a point where all relevant data and information is brought together from multiple sources. This single point becomes a powerful tool both for experience and transformation. It also becomes the one window in which the users spend most of their time in the day working, much like Outlook is for many business users. The likelihood of finding a software package that does 100% of what you want to do exactly the way you want to do it's very slim. In fact, it's impossible. Some level of customization or configuration is probably required to meet your unique requirements. You want to make sure that you select a solution that's highly configurable, or you're going to end up having to conform the way you work to meet the rigid structure of that application. The configurability of the system should apply to the process logic as well as the user interface and forms. The end objective is to have a user interface that's logical, intuitive for your users, and to help you achieve your objectives today while being able to scale tomorrow when your future needs arise. And ideally, you'd like to be able to do this configuration and manage changes yourself without being reliant on a vendor. Now, all health plans, as we mentioned, have some level of automation in place. In many cases, they're located in disconnected silos, and the users need to move from one application to another application to do their work, even when there's some level of integration between the application. Oftentimes, you find users cutting and pasting or rekeying data from one application to another application. And what you would like to do is find a technology where the integration is completely seamless and the users may or may not know in which application they're working. They're simply doing the job. Now, if one of your strategic priorities is to increase your compliance, the ability to have real-time reporting on compliance-related factors and performance is critical. Real-time metrics allow users and management to spot broken problem areas before they become compliance issues. Many technologies today are very difficult to configure and require either the vendor or your IT department to prepare necessary reports. Ask your vendors, how easy is it to prepare custom reports? How many custom reports come standard with the system? What training is required for your users to generate those reports themselves? And now that you understand those challenges and what to look for and some of the benefits, how do you put it all together? How do you generate a level of success to prove to your management that you made the right decision? Well, you're going to do that through generating quick win successes. And if we have time at the end of this, we'll come back and we'll talk a little bit about doing that. There is a way to structure your project so that you're guaranteed a higher likelihood of success. And you don't want to be one of those companies that has a failed transformation exercise because you tried to do too much too soon, or you did it in a manner that wasn't necessarily the very best. So I'd like just to show here the industry recognitions from Newgen. I'd like to take just a moment on this. Forrester and Gartner are two of the largest, most prestigious analysts in the industry, and both of them have analyzed Newgen solutions, and they've analyzed our platform as well as our individual solutions. And the platforms consist of enterprise content management, and that's a technology that's going to manage all documents in your organization, all records in your organization, scan documents, images, text documents, Word documents, Office documents, any kind of electronic document that you get in. It manages and controls that. BPM is business process management, and that's a technology that allows you to run a business process, whether it be involving data or documents. And we have one of the very leading BPM solutions in the world. And then case management is the evolution of BPM, and that is the ability to manage exceptions to a structured process. No matter how many structured processes you try to automate, you're always going to come up with some kind of exception that you need to handle. This is a low code, easy to use, quick method of collaborating with other people in building these solutions. And the last is customer communication management. These are the 4 pillars of our technology, and CCM, which is member communication management, allows you to control all outbound communications from all of your systems through one controllable central point so that you can get governance and standardization on all of your communications. All 4 of these solutions, or these pillars, are built from the same software code, and then we build a whole suite of solutions on top. One of those solutions is for appeals and grievances, a complete 80% fully designed out-of-the-box application to manage everything related to complaints, appeals, and grievances. Now, those organizations that had the $10 million in fines last year could have spent a small fraction of that amount and acquired a system for appeals and grievances. On the same exact platform, you can have a provider contracting solution to manage the entire life cycle of contract, from clause design and development all the way through managing and renewing contracts. Member communication management is another application that could be on the same exact platform. And this allows you, again, to control all outbound communication, digital or paper, to any one of your members, in mobile Medicare enrollment to speed up the enrollment process every year, every time you have one. These are just 4 of dozens of possible applications that can be used on this platform that we're offering. And every health plan that we're talking to is looking at 1 or 2 of these. They're also looking for BPM by itself to expand its use into other areas in the organization. And this right here is a topic that's worthy of an entire presentation just in and of itself, but we're going to spare you that for the moment. Each one of these applications that you can see along the top, provider contract management, servicing and configuration, complaints, appeals, and grievances, customer communication for member engagement, mobile Medicare enrollment, each one of these is a standalone application that's built on top of the platform that you see in the very center, the BPS and the OmniDocs. That platform is personalized for all of the users in the organization, in whatever department they're in. It allows collaboration between and among users. It handles exceptions and cases. It also integrates over on the left-hand side with all of your legacy applications and all of your internal systems. And it can do that in a seamless way so that the users who are in the top boxes up there working in those applications, they don't have to log into CAQH. They can get CAQH data automatically retrieved and input right into their screens automatically. And all of that is built on top of a platform that allows you to model and design your business processes. And when we deliver the systems, we have already designed and modeled those business processes exactly the way you do your business. And then you can come in and make changes as your business evolves. You can simulate it. You can forecast the behavior of your system given different loads. You can use devices such as mobile devices and tablets or laptops, real-time dashboards, configurable English language business rules. This right here is the high-level architecture of what it is we're offering. And every single health plan in the United States is interested in doing something like this right now today. So in conclusion, some of the key takeaways are that going digital or digital transformation isn't really a choice, but it's a fundamental necessity in every single business. Every business is competing for customers' wallet share, and they're competing for the satisfaction of the members and employees. You have to do this. And the members' expectations every year is getting tighter and tighter. It's evolving. You have to act, and you have to act fast or you're left behind. There is a gap, as we saw at the very beginning, between where we think we are in terms of the satisfaction of our processes with our users and what the members are experiencing. You need to identify that gap, understand the root causes, get some help to do that. We're happy to come in and help do that. And then you need to take care of that. You need to determine your high-level business strategies and goals and requirements, and then find a vendor that can help take you there. These are the key takeaways. I hope this has proven useful. And if there are any questions, we'll be more than happy to take some questions right now. And I'll ask my Healthcare Center of Excellence team, who's also on the call, to help field some of those questions. Any questions?
Thank you so much, Tim, for a wonderful presentation. We have some of the questions lined up over here. And meanwhile, other attendees can also type in their questions if they have any for the presenter over here. So one of the first questions that have come from one of the attendees is, how should I start digital transformation in my organization? Like, are there any first few steps that you can recommend?
Very good question. One of the very first things that you need to do is take an inventory. Digital transformation begins with digital. You need a digital inventory. What systems do you currently have in place? What systems are meeting your requirements? What systems are connected to other systems? There should be a high-level review of your IT landscape to look at what you're trying to do, or the intercommunication ability of your different systems. That's the first step. Second is, where do you want to go? What do you need to focus on first? Are you getting fines from CMS for lack of compliance? That's a pretty good place to start if you have. Or are you having members that are complaining? Are you getting lots of complaints? Maybe you need to start with appeals and grievances. So there are multiple different starting points, and every organization will have a different one. In fact, every organization we talk to has different ones. But we'd be happy to engage with you one-on-one and hear some particulars about your business in a little discovery call, and then we can help you fine-tune that.
Thank you, Tim. Another question that is common is, do you have a white paper or written example of successful work with large MCOs?
Okay, Prashant, can you address that, what we have?
Can you repeat your question one more time, please?
Yeah, so the question is, do you have a white paper or written example of successful work with large MCOs?
Managed care organization. Yes, we do have, and the person who has asked this question, we can definitely share with those. Yes, we do.
Okay, we'll be sharing that with them.
Yeah, we actually have one that's very, very interesting that'll talk about an organization that started off years ago on provider servicing and has added on every year more applications, and they are a really transformed organization as a result of that. And they continue to look at and evaluate more of these accelerators. Very exciting case studies. Happy to share that.
Thank you, Tim. Another question that is common is, how should I calculate the ROI for digital transformation?
ROI is going to depend on exactly the area that you're beginning with, but it begins with good metrics, knowledge, and understanding of the processes themselves, the time it takes to do that, the number of people involved, the cost involved, what volumes you currently have, what volumes you're going to expect in the future. And we can help you with a very high level, with a high level ROI calculation. And it's different for servicing and contracting and appeals and grievances, or even BPM. There are traditional methods and ROI tools available. We have our own proprietary that we use, and we're happy to sit down and work with you in a workshop environment to do that.
Perfect. Hope that answers the question. And also another question is, what is the standard implementation timeline for a project?
That's a really good question. Our experience in delivering these projects using the Pro-Agile method and solution accelerators can be anywhere from 6 to 9 months long. And that's from day one of the project all the way through going live. And that implementation timeline is less than half of what we see in traditional methods. If there's interest at the end of this call, or if anyone sends in a question afterwards, I'm happy to talk about how we used to do that in other companies and technologies and compare that to what we do.
Thank you, Tim. I think we can wait a minute if any other questions the attendees want to ask. So you can type in your question over there.
So I'm seeing one more question here. The question is asked by one of the attendees. How old is your appeal and grievances and provider contracting solution? So we are into this business of appeal and grievances and provider contracting for more than 6 years now, that we have many of our health plans implemented all these solutions.
And curiously, the framework upon which we're building and creating applications is conducive to creating new applications very rapidly. We were dealing with one health plan about a year ago, and there was this particular health plan was using mTaurus, which has been sunset. And they sat down and they showed us a functionality that they absolutely had to have. It was critical for them. And we were able in a period of 2 weeks to have that exact functionality added into our solution, completely obviating the need for that.
Thank you, Tim. I think any other questions that we have?
Okay. If there are no other questions, thank you very much for your time. Should you have any questions, please do not hesitate to contact us. We do look forward to seeing you in the FAHP meetings. Thank you very much for your time.